And then we take an update from the Honorable Minister of Environment before we switch over for the questions session, and then we take the responses. At this point, let me invite the Chairman of the Presidential Task Force on COVID-19 and Secretary to Government of the Federation to please come to the podium to present his remarks. Chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I welcome you all to the national briefing for Monday, 22nd June 2020. At the beginning of the month of June, the Presidential Task Force announced a 1-month period for the implementation of the second phase of eased lockdown. We have continued to monitor developments nationwide in order to take informed decisions at the end of the month. We have exactly 8 days to that point of decision. While pursuing that line of action, the Presidential Task Force would like to re-echo the World Health Organization advisory to countries and their citizens not to equate any slowdown in numbers accompanied by loosening of restrictive measures to translate to a reduction in the dangers faced by humanity. Yesterday, 21st June 2020, Nigeria crossed the threshold of 20,000, with our total number rising to 20,244 confirmed cases. This signifies to the PTF that more testing has been carried out in recent weeks. However, we are not deluded that we are getting enough samples to test. I wish to remind all our citizens that the best strategy remains to test, detect, isolate, and treat. That has accounted for the massive expansion in the laboratory network and testing centers. Now we have 38 spread across the nation. The Presidential Task Force has also continued to watch developments from other jurisdictions, especially those that have similar climatic and demographics with us. Here, Brazil is of particular interest. You would have observed that the number of confirmed cases in Brazil have risen to over 1 million. That's becoming the second highest in the whole world, and reporting over 50,000 deaths. In Africa, the World Health Organization has reported that South Africa, Egypt, Nigeria, and Ghana have proportionately been the most affected countries on the continent of Africa. All these combined represent a serious wake-up call for us all to be responsive and to take full responsibility for our actions. Ladies and gentlemen, our failure to take responsibility threatens the gains we have recorded, which is not good for our large population. Let me give you a vivid picture of how this virus has spread across our nation by timelines. In April 16, 2020, we had a record of 442 cases. By May 16, 2020, barely a month, the figures had risen to 5,621 cases. And by June 16th, another month thereafter, 2020, we had on our records of confirmed cases 17,148 cases. By today, we have on record, like I said in my earlier paragraphs of my remarks, over 20,000 reported cases. We really have a choice to make, and there is an urgency of yesterday in our choice. As part of our collaboration with the states, the Presidential Task Force team made up of the DG, Nigeria Center for Disease Control, and the WHO representative visited Plateau, Edo, Lagos, and Akwa Ibom states to assess the state of preparedness and control. The visit further gives us the confidence that sub-national governments are also taking the necessary actions to ensure that this fight is speedily won. I commend our state governors who have been responsive and responsible in taking up the task of sustaining the containment of COVID-19 in their states. The DG would, I believe, in his remarks, give you updates as to their findings and the encouraging news that they got and what they saw on ground during the course of their visit. On Saturday, 20th June 2020, we received the first batch of equipment supplies under the One UN basket. These supplies included personal protection equipment, testing kits, and laboratory equipment. I want to use this opportunity to thank the partners of the One UN basket and to look forward to receiving the second batch of these supplies. Their commitment greatly shows that partnership is the most important ingredient needed to overcome this pandemic globally. I similarly wish to thank the World Health Organization for the donation of oxygen concentrators, which has become very vital for case management. Also over the weekend, the Rotary Club International District 9125, a long-standing partner in the fight against polio disease, made a donation of essential materials worth over 10 million naira to support the fight against COVID-19. This gesture is also very much appreciated. The Presidential Task Force is pleased to express its appreciation to the National Association of Resident Doctors, NAD, for demonstrating the spirit of patriotism and understanding by calling off the industrial action its members embarked upon. Abiding by the Hippocratic oath further gives us comfort that we would win this fight. On the part of government, we would continue to ensure the welfare and safety of all workers will never be neglected. As we pursue the community engagement and risk communication strategy, the Presidential Task Force has identified lack of information about case definition protocols, location of testing centers, inability to reach call centers as obstacles to getting needed help. The Presidential Task Force has therefore directed that more awareness be created on the location of testing centers and how to get tested, especially when you fit the case definition. The call centers are also being re-energized for responsiveness. Our messaging on risk communication and compliance by the public will also receive very strong attention. We must develop a national wave of awareness creation to drive home our objectives. I therefore urge Nigerians to make use of these facilities and get tested. Similarly, I implore us not to be afraid of undertaking the COVID-19 tests. Testing positive for COVID-19 is not a death sentence, but failure to test, especially when symptoms are evident, could result to death, as it may be too late once the symptoms become full-blown. The loss of any Nigerian is not only painful, but most avoidable provided we seek early help. The Presidential Task Force is also not unmindful of the possibility of imports, especially through our land borders. For this reason, our men and women of the Nigeria Immigration Service remain vigilant, and this has resulted in the apprehension of 2 foreigners who tried to enter the country illegally over the weekend. This commendable effort is appreciated by men and women who are working tirelessly to ensure that they safeguard our borders and our territories from further importation of the virus. The declaration of Nigeria as polio-free nation last week is a welcome development, and we congratulate all those that participated in the long-drawn battle to rid Nigeria of the disease. This declaration is a signal that overcoming COVID-19 and indeed any other infectious disease is possible and shall be achieved. We use this opportunity to renew our call to the medical practitioners and hospitals not to neglect other diseases and ailments because of COVID-19. Finally, let me remind everyone that wearing your mask properly, observing social distancing, washing your hands, and avoiding large gatherings are critical to saving lives, including yours. Observe them religiously. I now have the honor to call on the Honorable Minister of Health, the DG, Nigeria Center for Disease Control, and the National Coordinator to update you on progress made and any other new issues. I thank you for listening.
Response. Honorable Ministers here present, the National Coordinator, Director General, Directors, Permanent Secretaries, ladies and gentlemen, I shall be re-echoing a lot of what the Secretary to the Government of the Federation has said, particularly in relation to the health sector. The confirmed cases of COVID-19 in Nigeria surpassed the 20,000 mark over the weekend, reaching 20,244 between yesterday and today. We also saw the highest number of daily diagnosed new cases last Thursday at 745, but over the past 24 hours, 436. While the overall trajectory was predicted as the course of events explained both by increased community transmission and rising testing capacity, it is a reminder that we must not only not let down our guards, but begin to re-strategize on additional measures of getting control of the situation. This will not be the sole responsibility of government, but of all citizens, individually and collectively. It is also the prime feature of the national COVID-19 Health Sector Response Action Plan of the Federal Ministry of Health, which tries to map a near, medium, and long-term health sector response strategy to the challenge across all areas of health over the next 3-year period. The plan is to be presented at the National Council of Health and applied to states for the development of state-specific action plans to address state peculiarities. As at yesterday, 6,879 persons in total had been treated for COVID-19 and discharged, while 518 in total have sadly been lost, with 96 persons in just the past week. Total samples tested are 113,575. Active cases are 12,847. Our case fatality rate is 2.55%. The experience we are making suggests that some of the fatalities recorded in our country may possibly have been saved if they had arrived designated treatment centers early enough. It is also emerging that the clinical condition of COVID-19 patients, especially the elderly and those with underlying illnesses, which we call the vulnerable, can change from mild to critical within such a short time that patients hardly have time to seek hospital care. I therefore again advise all hospitals to have the right index of suspicion and recognize and promptly refer suspected cases to designated treatment centers. Attempting to treat COVID-19 positive patients when not so accredited wastes their time, puts them in danger, and also puts all others involved at risk, including the innocent, other patients, staff, and personnel. I also advise persons with symptoms and those with underlying diseases, particularly also the elderly, to check into an isolation center for observation if diagnosed. This could save your life. Though up to 80% of cases can be asymptomatic, it helps to also bear the known common symptoms in mind, these being fever, cough, sore throat, runny nose, difficulty in breathing. Additional signs can be headache, diarrhea, nausea, and fatigue. While symptomatic treatment can be vital in preventing complications, close clinical observation in the center early enough can be decisive. The National Association of Resident Doctors, who embarked on strike a week ago, have happily suspended their industrial action following continuous dialogue, constructive engagement, and response to grievances that were tabled, like payment of hazard and inducement allowances and provision of personal protective equipment. In connection with that, we are happy to say that Nigeria received a large consignment of medical supplies on Saturday, the first of a series of deliveries from the United Nations Group in Nigeria and the European Union, which several ministers were on hand to receive at the airport on behalf of the federal government. The donation is very reassuring to us because we can now make up our stockpile, and it is made up of a large number of various categories of personal protective equipment and 547 oxygen concentrators, courtesy of the World Health Organization, which our experience in Nigeria shows are more in use than ventilators. Federal Ministry of Health particularly appreciates this addition to our case management assets, and we thank all the donors through the resident coordinator of the UN family in Nigeria, Mr. Edward Kalon. I was invited to visit the 063 Nigeria Air Force Hospital last Friday to inspect the COVID-19 Observation and Treatment Center there, a modern 25-bed center with facilities for managing mild and severe cases. An additional 200-bed hostel has been prepared as a backup isolation center in case of overspill. The center will complement the treatment centers in the Federal Capital Territory, which are able to handle isolation type 2 and 3 cases. I must commend the Defense Headquarters and the leadership of the Nigeria Air Force for the offer of support in the fight against COVID-19. The Air Force already supports the Federal Ministry of Health with mission flights to various parts of Nigeria. Departing from COVID-19, on Thursday, the 18th June 2020, the World Health Organization's Africa Regional Certification Commission for Poliomyelitis Eradication announced the pending certification of Nigeria as a polio-free state, an achievement worth celebrating considering that up to 2012 we accounted for about half the polio cases worldwide, and that we missed this distinction narrowly in 2016. The credit for this is due to all tiers of government, to our international partners, community leaders, and above all, the thousands of National Primary Healthcare Development Agency frontline health workers and resource groups. I particularly wish to commend and thank His Excellency President Mohammed Buhari for his interest, his commitment, and his unalloyed support for this program. The certificate will be delivered in August, but it does not mean we are resting on our guards. Our energy is already being redirected to supporting the fight against COVID-19, especially in this community transmission phase, with the community support program of the National Primary Healthcare Development Agency, using the Primary Healthcare Network, Primary Healthcare Center Network, and the experienced Human Resources for Health to drive surveillance, community case management, community engagement at grassroots level. I am mindful that in this regard, other health services like routine immunization, antenatal care, care for malaria and other ailments shall be maintained to ensure that our indices do not drop while we still stay polio-free. We must daily be reminded of challenges that COVID-19 poses to Nigeria and to the world, and to further reinforce our resolve to tackle the pandemic. We can reduce case fatality in Nigeria if non-pharmaceutical interventions are adhered to and scaled up, and if we become more proactive in dealing with the cases that we find. We can scale up testing, tracing, treatment, and isolation. And in that regard, we need the cooperation and collaboration of all citizens, but with priority on offering more protection to elderly citizens and those with comorbidities from threat of infection. Thank you for your attention. And I now invite the Director General of
Thank you, Honorable Minister for Health, Secretary to to the government of the Federation and Chair of the Presidential Task Force, honorable ministers, members of the Presidential Task Force, gentlemen of the press. Thank you very much for the opportunity again. Today we'll present to you some of our findings from a tour around 4 states in Nigeria, Akwa Ibom, Plateau, and Edo states. We went to these 4 states. We started with Plateau on Thursday, Edo on Friday, Akwa Ibom on Saturday, and Lagos on Sunday. The purpose of this trip, as always, is to engage with the leadership of the state governments. A lot of the work that we're doing on this outbreak has to be focused on the states. That's where the outbreak response is driven from, and we always have to go to the states, understand how they're doing, learn from their response, encourage them, and develop new strategies of working together. Also, it's always an opportunity to gain a better understanding of the situation on the ground, the differences in the different approaches in the states, and learn from each other. Firstly, I'd like to really thank the Nigerian Air Force again for their incredible effort. When I say we've gone to 4 states in 4 days, it wouldn't be possible without the support that they have continuously provided to this response. So, in the last few years, we've worked very hard to support every state grow its preparedness and ability to respond to infectious disease outbreaks. Slowly and quietly, we've been training healthcare workers, supporting the setup of emergency operation centers, supporting the deployment of a new surveillance infrastructure, supporting the establishment of new treatment centers. So this COVID outbreak, as difficult as it has been for the country, also provides us an opportunity to drive these developments even further. It's also gratifying to see that many states have learned from lessons in their own response to the outbreaks they have faced in the past and use this capacity to respond to the current outbreaks. These investments have helped the response to this outbreak and enabled many states not start from zero. I think the state where this exemplifies it more than any other is in Edo State. Edo State historically has suffered from Lassa fever outbreaks. We all know about that. But in the midst of that, they've also developed the Ireye Specialist Teaching Hospital, one of the premier hospitals that has developed the capacity to respond to infectious diseases. But beyond Ireye, we saw and met a very dedicated team at the University of Benin Teaching Hospital led by Professor Baseki at the Stella Obasanjo Hospital in Benin, and really saw a committed set of clinicians that were working very hard, innovatively, to deal with the challenge in front of them. But really most gratifying was the leadership of the governor of Edo State, Governor Godwin Obaseki, in how he had driven this response, personally led EOC meetings every morning to deal with the outbreak, understand the data, and use the data to respond to the outbreak. Another innovative approach we saw in Edo was the inclusion of the Edo diaspora in various universities across the world to help understand how they were responding. So really impressed by the work going on in Edo. Of course, there's a lot of work, a lot of improvement possible, but I think they've gone a long way and we have to encourage them. They've been testing a lot of people, we're getting the results, and we're fairly confident that if they keep pushing as they are, we'll get on top of this outbreak in Edo State. In Plateau, we went primarily also to commission a new treatment center at the Bingham University Teaching Hospital. This treatment center was funded by the Basic Healthcare Provision Fund, which was established a few years ago, and the development of this literally was because of the increased number of Lassa fever cases in Plateau. So these cases of Lassa fever had led us to making a small investment in developing the capacity to treat that. We didn't know that they would need this center for the management of cases of COVID. So that's another example how investments in health preparedness in one area supports health response in another. In Plateau State, we also visited the National Veterinary Research Institute in VOM, one of the historical centers where infection control has been led on the animal side, that is now one of the premier testing centers for a disease that is affecting the health of humans. So this collaboration between the animal and human sectors, as part of our One Health strategy that we've been implementing in Nigeria for many years, again shows you some of the developments that have been happening quietly in the state. So again, very grateful for the leadership of His Excellency Governor Simon Lalong, whose leadership really is driving the response in Plateau State. Well, not finally, but penultimately, we went to Akwa Ibom State. And to be honest, the level of investments by the state government in Akwa Ibom is probably parallel to no other. They've built a brand new treatment center, a brand new lab, a brand new EOC, all with state government resources. So really investing aggressively in public health in a way that probably would not have been fathomable many years ago. But it also shows the level of seriousness that states are now taking this problem with and actually investing money in the response. So we're privileged to go around these new centers, the new lab, new EOC, new treatment center, and really congratulate His Excellency Governor Udom Emmanuel on the investments made in Akwa Ibom. It's very critical and was really gratifying to see states taking responsibility, investing their resources, working with the federal government on this very difficult outbreak. We ended up with Lagos. It was a short visit in Lagos. We were swapping teams. A team was coming back, a new team had taken over. So the visit in Lagos was really to encourage them. The teams have been there for quite a while now to keep pushing and supporting Lagos. So I'd like to conclude by saying that, yes, the states in Nigeria vary by their capacity, by their circumstances, by their realities. But there's a lot of best practice coming out from the various states. How they're leveraging on previous investments, leveraging on federal government institutions, leveraging on the private sector, leveraging on their diaspora in this response. So we're really learning from each other. But really, the part that will stay with me the longest is visits to the treatment centers. I really saw clinicians working extremely hard. My discussion with the clinical leader of the University of Benin Teaching Hospital, who started up the treatment center in that hospital. When he started, he was the only physician with the courage to start. Slowly, other people came on and joined, and I see them working 12, 15 hours in this fight. And really, as tired as we might be in carrying out the things we need to do, we're really encouraged by the courage and the efforts by our clinical leaders. I must say the one area that worried us the most as we traveled around the country is that we still struggle to see sufficient people wearing masks. We still saw gatherings of too many people in a place at a time. And we know that across the country, we're struggling with this. And I really want to encourage all Nigerians. We can't treat our way out of this. We simply can't. We have to prevent. It's the only chance we have. So as we work hard, as we congratulate those treating, we must take responsibility for prevention. It's in our hands. Let's take responsibility collectively to get out of this outbreak. Thank you very much.